Up to 90% of human behavior occurs at the subconscious level. Pain and injury are subconscious responses that do not occur in isolation. Commonly, they are linked to other behavioral responses. Pain, injury, and motor control are all subconscious responses that can be linked together and encoded in memory. Assessing changes in strength and motor control can be used to assess relationships and associations that have been coded and stored in memory. Any muscle group can be used for assessment purposes, but generally smaller muscle groups with larger moment arms allow for more visible and measurable change. The shoulder can be used to assess motor responses. Before beginning assessment, ensure that the patient has no history of shoulder pain or injury. If they do have shoulder pain or shoulder injury, use other muscle groups to test. The patient is positioned in supine with the testing arm furthest from the therapist. The arm is placed into 90 degrees of flexion with the elbow in full extension. The arm is internally rotated to target smaller muscle groups. The therapist places the hand onto the patient's wrist and then uses their body motion to test the patient's strength. The patient is instructed to meet the therapist's force, and the force continues to gradually build until the patient can no longer resist the force and breaks. This is called a break test and is the base test for motor control. To assess memory responses, the clinician will test strength as a basis for comparison. The clinician will first test the base strength and then ask the patient to describe their injury or pain. The clinician will retest motor control and assess differences. Often there will be a notable change in motor strength and control. For comparison, the clinician can also place their hand upon the area of injury and test strength. When properly primed to think about pain, the tactile cueing can be a memory trigger as well, and motor control changes and motor control strength changes will be seen.